all of you for taking a half an hour of your life to learn some things about science and about chiropractic and about health. And we're going to be talking a lot about all three of those tonight. So before I get into the slides, I want to ask you guys some questions and see what you say. So I want to ask first, what is science? What exactly is it? Because there's, in the last 20 months, it's all we've heard. Heard science this, science that, scientific method, this is scientific, this isn't scientific. So what is it? When you say what science, can you give me a concise definition, Terry?
This is what I've always believed, because I've been asked that probably since I can remember. Science is the study of our environment.
Okay.
Quite
Study of our
simply.
environment. Okay.
Very simple, yeah.
So asking anybody else want to
Such a broad topic.
take a stab at that? I would say this. Science is asking and investigating questions into things that we don't know.
Okay.
Okay? It's pretty
That's
broad. Okay?
Oh, yeah.
So when we say that something is scientific, like something is scientific or something isn't scientific, we say something's scientific, what do we mean by that? What does that mean?
A factual based, proven based information.
Okay? Proven based on what?
Research?
Yeah, research. Objective research. Okay? Now when we talk about healthcare, I'm not an engineer, so I'm not going to talk about engineering science. But when you talk about healthcare science, what is the standard, the basis of what we consider scientific in healthcare? Who can say? Anybody?
I don't know if there's an overarching standard throughout all of healthcare. It seems like some of it's by decree, and then some of it has actually been tested many times under randomized control trials.
Okay, you said the magic word. Randomized trials. Okay, so what is a randomized trial? Anybody know what that is? When I say randomized, what do I mean by that? Because you're going to hear that a lot. So you need to know what it is. Okay? Nobody knows. Okay.
Bunch of different ideas and try them out.
Okay. Bunch of different ideas and try them out. Okay. So I'm going to give you my definition of a randomized trial. So you want to find out if something is true or not, if something works or not. Okay? It could be a pharmaceutical. It could be a nutritional supplement. It could be some sort of modality, some sort of physical modality. It could be a medical device. It could be anything. So you want to find out whether that works. Okay? So what you do, a randomized trial, is you take a randomized group of people, okay? And you could select it all ages. You could do it male and female, male or female, but let's say you have 60 people. You randomize, you pull them out randomly, and then you divide them in half randomly. Or you divide them male and female, so you have the same amount of males and females in each group, okay? In one group, you apply whatever you're going to apply. In the other group, you do what's called a placebo, okay? So placebo, in pharmaceutical studies, they say a sugar pill. Well, I think that'd make people sick, but, anyway. But you say a placebo, something that doesn't work, or something that does. It's supposed to work. Okay. Now, the thing that makes randomized trials even better is whether they're blinded or double-blinded. So, do you know what I mean by that?
Yes.
What do I mean by blinded?
It means they don't know which one they received.
Right. They don't know. Right. Double-blinded, what does that mean?
The provider doesn't know either.
Provider doesn't know either. Okay. So, and why would they double-blind a study?
To get true and accurate
So
results.
there's no bias.
Hopefully.
So the person, if it's just blinded, the person giving the nutrient might give off signals or the
In
the
my
drug
job.
that, hey, this is the drug,
They do.
okay? So there's certain, so you don't want anybody to know, okay? That's the gold standard in healthcare, okay? Now, if we look at the COVID issue for the last 20 months, let's take masks for example. You know, I read a long article on the studies on masks. There was not one study, not one randomized trial that showed that masks are effective. Not one. Okay. Now, if you want to wear a mask, I'm not browbeating you. Okay, it's fine. There's not one study that showed they were effective. Okay, and there were 2 studies that show that they weren't effective, and those were retracted immediately, and they were both good journals, which tells, now that's a whole subject I'd like to get into, but I won't. But what are the 2 things that really hamper the scientific method? Like if you're going to do a randomized trial or randomized trial, what are 2 things that can really hamper the results, or really taint the results? Anybody? Terry?
False information.
Okay. Misinformation caused by what?
Controlled media.
What?
Controlled media.
Media? Okay. I would say something broader than that. Bias based on what? What are the 2 big, I mean, just look at the information on COVID. What are the 2 big things that are biasing the whole COVID thing?
Social media.
Okay,
No, you said
politics is one.
Yeah, you said
Politics,
Agendas.
okay?
And money.
And money is the other one, money. So, I think it was Pfizer, correct me if I'm wrong, because I'm not sure on this, just came out that said their vaccine works for kids. Okay?
Yeah, correct.
Their vaccine works for
That was
kids.
Pfizer.
Okay, do you think that there's a lot of money in that for Pfizer?
Oh, hell yeah.
Oh, yeah.
Oh, they've made billions.
5
Yeah.
times what they
Yeah, there's a
made.
lot of money in there. Now,
Billions.
let me tell you about studies, okay, because I've seen these studies actually in the journals. They're actually in studies on pharmaceutical companies and third-party studies that evaluate pharmaceuticals. And here's what they found. And I'm going to get into my slides, okay? I'm really going to get into
Yes,
this, but
okay.
I want you just to think about science. They found out that when a pharmaceutical industry company does studies on their own products, that they come out usually much higher positive rate than when a third party does it. When a third party studies a drug, the chances of that coming out positive are way less, okay? Now, these are studies that have been published in medical journals. So we're going to talk about the science behind chiropractic. Now, a lot of the chiropractic studies are blinded, but they're not double blinded because people giving a fake adjustment know they're giving a fake adjustment. You can't double blind that, okay?
Right.
But the studies are blinded. Now, let's look at first thing. This is the first chiropractic study that was ever published, 1921. The very famous study called the Windsor autopsies. Henry Windsor was a medical doctor. He's from Philadelphia. He was found. What he saw was he had patients that were going to chiropractors and osteopaths that were getting better. He wanted to figure out why. Okay, so he was going to do autopsies on both humans and animals to find out if there was a relationship between the spine, problems in the spine, and organs. Okay? So he's at the University of Pennsylvania, which, by the way, is an Ivy League school, one of the best schools in the country. He dissected 75 human and 22 cat cadavers, and he found out of those 2 groups, 221 diseased organs. So he found out nearly 100% correlation between minor curves of the spine and diseased organs. Okay? Now, here's what he found, and we don't have to go through all of this, but in the sympathetic nervous system, he found like diseases of the heart and pericardium, all of them had problems in the upper thoracic area. All of them. Lungs, all the upper thoracic area. So if they had disease of the heart and lungs, he found problems, curvatures, degeneration in the upper thoracic area of the spine. Stomach, mid-thoracic. Gallbladder, mid-thoracic. Kidney diseases, all of them, lower thoracic. He found this very, very consistently, that certain organs had certain parts of the spine that had problems. Okay, liver disease, all 13 cases had misalignments of mid-thoracic spine. Now, it is rare to find an organ that was not supplied by the same sympathetic nerves as the vertebra and the curves. So it's rare to find an organ that was diseased that wasn't connected to that same part of the spine. Now, here's another thing. He found many of the organs showed acute disease, while the vertebra, the nerve supply to those organs in the vertebra were older. The problems in the vertebra were older and more degenerative in nature. So what he deduced by this is that the problems happen in the spine, which create problems in the organs, which then the problems in the spine get worse and actually age the person. So what he found was that we can say a man is as old as his spine, basically. He found disease appeared to precede old age and not cause old age. The spine becomes stiff and old age follows. Okay? So a man is as old as his spine. This is the first study ever done that I know of on chiropractic. Now let's get some recent studies, okay? This is a University of Iowa study on some Medicare patients. Demonstrated the following with seniors under chiropractic care. They had fewer functional limitations, less difficulty in engaging activities such as lifting and walking, and they had lower number of doctor visits and hospitalizations. Now this last one is pretty easy it's pretty easy to measure, okay? So they concluded that chiropractic had a protective safeguarding effect against physical deterioration. So this is a chiropractic group. This is a non-chiropractic group. Which one do you want to be in? Okay, I'll just ask you that right now. Okay, you don't have to raise your hand. Okay, so chiropractic and pregnancy. There are a couple of really good studies on this, and this is a combination of the two studies. 115 pregnant women experiencing pain in their back or pelvic region. They'd not had chiropractic care in 3 months. So what they did is 1 week into treatment, 52% noticed a reduction in pain. Okay, so this is patients just checking off the pain scale. Okay, that's how they measured this. Okay, 1 month into treatment, 70% had reduced pain. 6 months into treatment, 90% had a reduction in pain. So 2 other studies on chiropractic and pregnancy revealed that pregnant women under chiropractic care had half the delivery time compared to women with no chiropractic. Okay, why do you think that is? Why is that? Anybody?
Proper function would be restored.
Yeah, function of what?
Of all the pelvic organs.
Yeah, the uterus.
And the spine.
Yeah.
Yes.
So the uterus has a nerve supply that comes from the spine. It has to work right. There's that connection has to work properly for the uterus to work right. Here's another thing. If the pelvic area, if this is a pelvis, okay, and it comes together like this, and the uterus sits in there, the pelvic area is torqued. Do you think it's going to be as easy to deliver that baby?
No.
No, it isn't. No. Okay. So when you get that thing as normal as possible, baby's going to be easier to deliver. So Annals of Internal Medicine, okay, which is now JAMA Internal Medicine. They've changed the name of it. 192 patients with back-related leg pain. Half were given chiropractic care with home exercise and advice. Half were given only home exercise with advice. Chiropractic patients were given 20 visits over 12 weeks. So at 12 weeks, the chiropractic group had less back pain, less disability, better overall improvement, and patient satisfaction. At 1 year, patients who received the chiropractic care still had overall improvement in satisfaction. But they were only adjusted for 3 months, basically. So here's 2 recent studies in Canada, one in Canada and one in Tennessee, showed that on average, chiropractic care was 40% less costly than medical care, and patients were more satisfied with the results. And that's in the Journal of Manipulative and Physiological Therapeutics, 2010. And the other journal was Biomed Central, 2015. Here's a study from Dartmouth University on the safety of chiropractic care for older people. Found that of people over 66, of which I'm one of them, who received chiropractic care, 76% had a lower rate of injury within 7 days of treatment compared to those who saw a medical doctor. Now, I'm not putting down medicine here. I just want you to know that. But why would this be? Why do you think this is? Why do you think they got that result? Anybody?
Because maybe the chiropractic approach is addressing the causes as opposed to, I hate to bag on Western medicine, but it's usually more about, quick, let's deal with your symptoms and be on our way.
Okay. So when you say cause, tell me what are they fixing there that...
Well, it's back to getting your adjustment, so, you know, everything's connected back right to your spine and that whole, your whole system.
And your central nervous system. So what I think what you're getting here is proprioception, so you're not falling as much. They have better balance. Okay. So here's what you don't want to happen when you're older. Okay.
Ever.
So, or ever, right? Yeah. When you're young too, right?
Exactly.
So,
Call in the Marines to get me up.
yeah. So, Archives of Physical Medicine and Rehabilitation. They took 40 men that were diagnosed with degenerative disc disease. Half were treated with chiropractic, half with the placebo. So there's your randomized controlled trial. Results from patient who received one adjustment. So I said, what happens after one adjustment? Okay. Less pain, increased spinal mobility, better hip flexion, and they had a significant measurable increase in height. That's an interesting study because, sometimes I get that with one adjustment, but not always, okay? So that's really interesting. Chiropractic in the workplace. Here's 2 studies out of the Journal of Occupational and Environmental Medicine. 17% of U.S. workers have absenteeism as a result of neuromusculoskeletal dysfunction. So that would be like low back pain, neck pain, shoulder pain, things like that. So chiropractic care offered on site at the workplace. So these are companies that had a chiropractor on site, showed improvement in both pain and functional status. But here's the big ones: lowering of overall health costs. Workers use fewer drugs, have less physician visits, reduced worker absenteeism, increased employee productivity. Now, here's a question I have. Why wouldn't every company have a chiropractor if you're getting this?
Not everybody knows about this stuff.
Not everybody knows. That's right. But here's another answer. I talked with one of the human resources people at a company that I spoke at, and I talked about this study, and she said, here's a problem. She says it's the way the government handles things. So a chiropractor is considered a primary health care provider. So if one of the workers has a problem and goes to a chiropractor, if they are on site, they have to report that to OSHA. So you have enough OSHA complaints, the government swoops down and gives them a big fine, starts hassling them, and it's not worth it. It's not worth it to them. And that's pretty sad, I think. That is government interference in healthcare. So here's cervical disc herniation and neck pain radiating into the right arm. 50 patients treated with chiropractic who had confirmed cervical disc herniation. They had moderate to severe arm pain, They were given chiropractic adjustments at the rate of 2 to 4 times a week until pain-free. Okay, now I don't know how long that is, but for some people that I see, that might be a while. Okay, if you really got a bad herniated cervical disc, that's going to take some time to fix that. Okay, at 2 weeks of care, 55% were improved. At 4 weeks, 69%. At 3 months, 85.7 or 86%. And it said spinal manipulative therapy was 2 to 3 times superior to published studies of patients receiving cervical nerve blocks with steroids. So I'm not saying that's never not necessary, but what's a problem with these things?
Just covers it up.
Yeah, it covers it up and it wears off.
Mm-hmm.
Yeah, over time it wears off. It's not fixing the problem. Here's the next couple studies I really like a lot. Here's what changes. So in this particular study, they looked at how does the chemistry of the body change when somebody's adjusted. Okay, so now up until now we've just looked at neuromusculoskeletal dysfunction. So they had three chemicals that are known to suppress pain. And they have other physiological effects. So 30 subjects were divided into 3 groups. One got cervical, one got thoracic, one group got no adjustments, okay? All 3, so with cervical adjustments, they adjusted the spine, adjusted the neck, and then measured this. All 3 chemicals went up, okay? Cortisol, oxytocin, neurotensin. Neurotensin and oxytocin went up with thoracic adjustments. So when I adjust somebody, I'm changing the chemistry of their body. Now, sometimes it's slow over time, but the chemistry does change, and this is a proof of that. Here's Medical Science Monitor. This is February 15th, 2016. So this was a study that looked at what happens when somebody loses a curve in their spine. They wanted to look at mechanics and blood flow to the brain. So they looked at a group of people and they found out, number one, they get degenerative process in their spine. They get pain, headaches, and quality of life issues. But here's the other one. This is really important. Loss of curve also causes a decreased blood flow to the brain due to changes in the vertebral artery, which go up the side of the neck. Okay, so you can have this and not have any pain and not even know it. Okay, so it can change blood flow to the brain, which would change what?
Function.
Brain function.
Cognitive function.
Yeah,
Homeostasis.
cognitive function.
Yep.
Right. So here's an example. This is an example of what happens during an accident. So the cervical artery flows right along here, so you should have a nice C curve. Okay. So when you lose the curve, now you got a kink in the cervical artery. Okay, it's stretched. Okay, now you're not going to get blood flow to the brain. This is why I spend so much time talking to my patients about their home exercises, because I want to go from here to there. Okay, I can't do it in the office. You have to do it at home, your exercises. So I give, for those of you who don't have a good cervical curve, I give home exercises because this is what I want to accomplish right there. So this is Journal of the American Medical Association 2018. They did a study on 3 military bases, and they looked at spinal manipulative therapy or chiropractic care for lower back pain. They found out that chiropractic care resulted in a lessening of lower back pain intensity and disability, had a low risk of harm, high patient satisfaction, perceived improvement in active duty military personnel. So chiropractic and migraines, April of 2015. 3 groups of migraine sufferers were divided into groups. That's a little bit redundant, isn't it? One group received chiropractic adjustment and drugs. One group received the sham adjustment and drugs. One group received drugs only. Study lasted 6 months. Okay, here's the results. After 6 months, the manipulation plus drug group were able to reduce their drugs by 80%, their migraines were reduced by 97%, and their functional disability by 100%. Now, when you look at this, this is a pretty significant statement, because when you think of all the people in our country that would get disability checks, there's a lot of people out there. You wonder if everybody had chiropractic care, how much could we drop the disability rate in this country? I mean, you're not going to get rid of it, but you could, let's say you dropped it 30%. That's a lot of money that the government wouldn't have to pay out. Okay? The meds plus sham manipulation group reduced their drugs by 68%. Their migraines were reduced by 17%. They had a 33% reduction in functional disability. The meds only group had a 1% reduction in migraine headaches, 0 reduction in functional disability. So which would you rather be? The migraine girl or the happy girl? Okay. This is another one. This is at Tohoku University Graduate School of Medicine. This is in Japan. They looked at what happens to the brain when somebody's adjusted. Okay. So the cingulate cortex, which has to do with learning, memories, and emotion, the function in that part of the brain increased. This was a PET scan they did. The cerebellar vermis, which is back here, which has to do with proprioception and movement and emotions, posture, increased. Part of the brain which primarily senses pain, they saw reduced in that area. So what does this tell you? If the brain perceives pain and you get adjusted, what that's doing is down-regulating the pain centers in the brain, which is why you don't feel as much pain when you get adjusted, okay? They have salivary amylase, which is an enzyme which increases with stress, was significantly reduced. Now, I'm going to go through some slides here. I want to talk about this. Anybody in here heard of NNT, number needed to treat? Have you heard of it, Natalie? Number needed to treat, number needed to harm, okay? This is really, really big in healthcare. It's huge. Okay, so I want you to get what I'm saying. Okay, this is one of the core of medical research right here. So NNT is the number of people that need to be treated with a particular therapy to get one individual well or to prevent one occurrence. So how many people need to receive a certain drug, a certain medical device or whatever to help one person? Okay. So the NNH is how many people needed to be treated before one person is harmed. Now, you can look all this up online. There's a website, you can look this up. I think they've changed it since I got this. So NNT, number needed to treat, NNH, number needed to harm. So let's look at some common pharmaceuticals. Statin drugs. The NNT is 103 over 5 years. So 103 people need to take a statin over 5 years for one to be helped. Is that good?
No.
No, it's not. That's the NNT of statin drugs. Okay.
What is a statin drug?
What?
What
For
is
cholesterol.
Cholesterol-lowering
Cholesterol.
drugs.
Cholesterol.
Okay. So if you would you see a chiropractor if 103 people needed to see a chiropractor for 5 years for one to get better?
No.
Are you kidding me? We wouldn't have a profession, okay? So let's look at another one. Antibiotics for upper respiratory infection. None were helped for infection. 1 in 6 helped for cough. So the NNT is 6. Not too bad. Coronary bypass surgery for preventing death in 10 years. NNT is 25. So 25 have to have the surgery. For one is helped for one is not dead in 10 years. Aspirin to prevent heart attack. 1 in 2,000.
Wow.
So all these people taking aspirin, okay, 2,000 people need to take it before one person is helped.
It's crazy.
Now the NNT of chiropractic care is estimated, I read this in one of our journals, to be 1.8 to 2.4. Okay, that's not on that website. That's just what I read in a journal. But I want you to understand that concept, because we have this idea that everything is safe, proven, and effective but it really isn't. Okay, some things are not effective, but people do it anyway. Okay, and so I do a talk, which I'm going to do later this year, called the non-therapy of many medical therapies, where I get into a lot of this stuff, where things that are done every single day to people that have no scientific basis for it. And so those are things you need to know. And where do I get that information? I get it out of studies, books that I read by physicians who talk about it. That's where I get all that information. Okay? So I hope that this helped you understand that there is some good science behind chiropractic, and it's being published all the time. I mean, I could have done a 3-hour talk on this. I just hit some of the highlights. So for those of you who know somebody who's sick and who's not well and who's not getting well, bring them in. Let me just check them out. I'll just do a posture check, leg length check, and say, here's what I'm finding, and this may be part of what's going on with you. Before I go, any questions about anything I went over? Terry?
I have a sister-in-law she lives in Phoenix, Arizona, so she can't come in to see you, but she's been to several chiropractors, and she can't get any relief for her migraine headaches. It's bothered her for as long as I remember, and I've suggested a lot of things to her in letters to try to help her. But the thing about it is, every different chiropractor that she's gone to, they can't help her.
Well, I'll give you the name of a clinic down there that probably can.
Okay.
Yeah.
You
In
give that
Phoenix,
to me.
yeah.